Hello, everyone. My name is Gitika Gorthi, and today I'm very honored to have a special guest today with me, Dr. Paul Klotman. Dr. Klotman is the president and CEO of Baylor College of Medicine and has been for the past 10 years. Dr. Klotman completed his medical training at Duke University Medical Center. His research has been a blend of both basic and clinical research in molecular virology and AIDS pathogenesis. In addition to his laboratory efforts, Dr. Klotman has also been an active clinician, teacher, and mentor. I watched a few of his videos on the COVID-19 pandemic on the Baylor College of Medicine YouTube channel and grasped so much information that I did not know before. He explains even the most complicated subjects in a simple manner by breaking the content down. Inspired by his words, I too wanted to be a catalyst in educating others. I know a lot of my neighbors, friends, and myself have some questions about the current state of the pandemic lingering in our minds. So I want to thank Dr. Klotman for taking his time to answer some of our most common questions about the COVID-19 pandemic.
Well, I'm glad to be here. And it seems like most of my days I spend with my neighbors asking me questions or people calling in for questions. So happy to do it.
Awesome. Yeah, my first question for you is, what is the importance of masks, and are they still required for those who are vaccinated?
So this was an interesting thing, and very confusing the way it rolled out because there was not a lot of evidence, or let's put it this way, there was mixed evidence that masks were effective for flu. And where it was studied, like in families where everyone wore a mask, it worked very effectively. But in studies that were sort of done randomized in the community, people would wear a mask in the hospital and then they go out in the community. And so it wasn't really masking all the time. And so going into this pandemic, there was kind of a debate whether masks would really help. But fairly early on, when we saw the evidence in Singapore that in-hospital transmission was dramatically reduced by wearing masks, we all thought, we should wear masks. And that's what we did. So hospital workers and people like me who run his health system said, our workers need to wear masks all the time. And we even masked our patients. The problem was early on, we didn't have enough masks. And so, the CDC came out, and this was one of the early parts of the confusion. We were going like, please don't wear a mask because we need it for hospital workers. And that, I think, left this confusing thing that once there was enough masks available, then we started saying, well, everybody should wear a mask. And some people said, well, you just told me not to. Now you're telling me to. So, and if you look, there's been a bunch of studies now that came out of actually particle physics people, fluid wave people, some engineering programs, one from Duke, all looking at the efficacy of masks. And it is clear, if you wear a mask, you cut down on transmission from others by about 50%. And then if they're wearing a mask, it's almost like down to 10%. So you really have a very effective barrier if everyone's wearing a mask. The problem is it became politicized. And so a lot of people go, I'm not wearing a mask, it's my personal freedom. Well, it's your personal freedom to get infected too. The problem is they also are, transmitting in the community. But masks are very helpful. Now, if you're fully vaccinated, the CDC has said you don't need to wear a mask anymore indoors. The problem with that is the Delta variant is pretty infectious, and there are what's called breakthrough infections. So people who are fully vaccinated, 95% of the time are fine, but a small number get infected. Mostly it prevents them from going to the hospital and getting, and dying from the disease, but not 100%. And so I still don't feel comfortable in large gatherings where I know people aren't wearing masks, and I know not everyone's been vaccinated, and we still have a lot of viral burden in our community. We still are having several hundred cases a day. So I think personally, my choice is, and I'm fully vaccinated, I don't go to large crowd events. And if I do and I'm indoors, I wear a mask. Now, that's not the CDC recommendation. It's funny, the WHO now just came out with that recommendation that even if you're fully vaccinated, if you're in large groups indoors, you should probably wear a mask. And that's because if you look at Israel or United Kingdom, where they're farther ahead of us in vaccination, their case rate was very low, but now it's beginning to rise because of the Delta variant. So, I think the best way to look at it is if your community is highly vaccinated, you have a lot more freedom. So if you're in the East Coast and 90% of your community is vaccinated, I'd feel pretty comfortable. But Missouri, Arkansas, Wyoming, where vaccination rates are very low and disease is very high, I would feel comfortable walking into any group in those states. So you have to kind of know what you're doing.
100%. It's great insight. And a lot of us are trying to also wonder what's the future of the pandemic. Obviously, it's very difficult to predict how it will be. But looking back at the pandemic that happened in 1917 and 1918, which lasted, I believe, around 4 years, what do you think the path for the COVID-19 pandemic will be like?
Well, that's a question on everybody's mind. It's interesting. The Spanish flu started in 1918 and was really spread around by World War I. And of course, it really didn't start in Spain. It had started in probably in infection in Southeast Asia, maybe, but it was really started in the U.S. in the barracks of the United States Army, and then we spread it around. And by 2022, it was really gone. 1920 was really gone. So it was 2 years, about 2.5 years before it disappeared. And that was, again, because people were wearing masks, following public health measures. The problem with the world today is it's a global world. And so where there are hotspots, there continues to be evolution of the virus. So right now, the very southern tip of Africa, Namibia, South Africa have high rates. Argentina, Brazil, very high rates in South America. Chile now. Mongolia has high rates in Tunisia. So there's hot spots where there's very low vaccination and high replication rates. And in those areas, until the population gets either vaccinated or completely infected, it'll continue to kind of be, around. Now, will it disappear like the flu? It could. If the world's population it gets to 2/3 or 3/4 vaccinated, and another 10% or 15% have had the infection and are now resistant, it is possible that, assuming a variant doesn't emerge that's completely resistant to the immune system, that it could be gone in 2, 3, 4 years. It's also possible, equally possible, I think, that it'll become an endemic coronavirus. So if you think about the common cold, we get that all the time, right? Those are endemic coronaviruses. We live with those. Highly infectious, but we get over them. They're mild. It could convert into something like that, where we have an endemic seasonal pattern. But with this virus, the immunity to it with vaccination has been pretty good. I mean, and there's evidence, ever increasing evidence, that the immunity is longer than we predicted. And so it might be that if we get enough people vaccinated, we'll be resistant to this coronavirus, and this one disappears in time. Of course, there'll be others. So we always have to be prepared, because there's always going to be another endemic around the corner, or pandemic around the corner.
Yeah, thank you so much for those insights. And, what are the efficacies of the vaccine? Because I've heard a lot of rumors about how, well, not just necessarily rumors, there's been a lot of cases on how the vaccine has had a lot of negative impacts on different people. So what are your thoughts on that?
Yeah, so this is really unfortunate, and I think it's, again, being amplified in social media. If you just look at the data, the 2 RNA vaccines, Pfizer and Moderna, are incredibly effective, more effective than we ever anticipated, and no one expected it to be this good. So they're 95% effective in keeping you out of the hospital and dying, which is really the most important thing. They're about 85% effective at preventing symptomatic illness. That was to the original strain when it was done. Now, as the Delta virus and these other, the Brazilian variant and the South African variant came up, and then now the India variant, the Delta virus, they are more resistant. But the thing about being able to manage a virus, we look at the amount of antibodies in your blood as titers, dilutions, how high is the antibody level. And if it's high enough to kill all the viruses, even if it's less effective by 2 or 3-fold, it's still enough to handle the virus. And so far, the RNA vaccines have been shown to be effective for all of the variants, including the Delta virus. The Johnson & Johnson vaccine, which is a slightly different technology, it's a DNA virus brought in through an empty adenovirus, another sort of respiratory virus. It's also very effective. Unfortunately, with one dose of these vaccines, they're not effective because your titers aren't high enough. So you need to get both doses of the RNA vaccines. And the AstraZeneca vaccine, unfortunately, has been less effective. And Europe put all of its cards in that basket, and AstraZeneca has been the least effective of the top 4 vaccines. So, but they're very effective. So if you're eligible, you should get 2 doses or whatever vaccines are out. Mm-hmm. You should get both doses or 1 dose of the Johnson & Johnson, and that will be effective, very effective against all the variants so far.
Yes, I have actually recently gotten my Pfizer vaccine, so I'm fully vaccinated now, and 100% would recommend everyone to get vaccinated. And so my last and final question for you is, what final piece of advice do you have for everyone regarding the pandemic right now?
Yeah, well, first and foremost, get vaccinated, and convince everybody that you know to get vaccinated. I didn't address one of the other questions you mentioned, but some of the rumors about what's the complications. There is no data that it causes infertility. Not only no data, there's no evidence. There have been plenty of pregnant women who have gotten vaccinated. It works perfectly fine. There's no reason why it would work. And the British Fertility Society came out and said, like, this is all social media rumor. It was started by a soccer player who posted an expose about these vaccines causing infertility. And it was picked up by social media, and everyone spread it around. There's absolutely no evidence for that. You do sometimes get a little achy-wakey after the second shot. I had nothing. Most people get nothing. If you look at the studies, only 5% had anything. It seems like everyone says, oh yeah, I felt really bad after the second vaccine. Well, I think if you had a placebo, because in the placebo-controlled trials, people said the same thing after their second dose of placebo. So I think that, just get vaccinated, tell everyone to get vaccinated. And I think, we have to be respectful of people who can't, so far kids under 12 and people with serious medical conditions. If you don't get vaccinated, you end up being a big risk to them. So it's part of not only you're doing something for yourself, you're actually helping the rest of humanity by promising not to be a vector.
Yeah, definitely getting vaccinated and also being mindful of your community by wearing masks where you think it's necessary.
Yes,
it's very, very important. So I want to thank you so much, Dr. Klotman, for your insight.
Happy to do it.
And for explaining everything so simply. I really appreciate it.
Well, thanks for inviting me, and good luck. And if you have any other questions, you can always write me at president@bcm.edu, and no question is too goofy. So I've gotten some goofy ones. So please, if anybody's sitting there and listening and wants to ask another question, just feel free to write me at that email address, and I promise you I'll answer.